I am the program coordinator for our OneOp Lifespan Caregiving Group. It's my pleasure to welcome you to today's webinar on improving health and wellness by getting outside. In case you're joining us for the very first time, I'd like to give you just a brief tour of our webinar platform so you can find your way around. So hopefully you're currently able to view the slides that we're sharing. If you're unable to see them or have any difficulties, please email us at contact@oneop.org for tech support, and we'll get that email posted in here shortly. Thank you, Coral. As some of you have already done, we look forward to having you join us in the chat pod for conversations and questions. To embed the chat pod so you don't miss any links or conversation, simply place your cursor over the slides, shared slides. You'll then see a toolbar pop up across the bottom of your screen. From there, just click that chat bubble icon. And when typing questions or comments throughout today's session, please be sure to select the Everyone from the response options drop-down menu so everyone's able to view them in the chat pod. And you'll notice Coral Owens has posted a link to the slides and resources today. Those slides and resources are available for download, and they're on our event page for today's session. We're going to be covering lots of CE opportunities at the end of the webinar today, so please stay tuned at the end if you're interested in continuing education credits or just a certificate of attendance for attending today. Thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and network of the professionals supporting our military service members and their families. Before I go ahead and introduce today's presenter, if you will, I know a few of you have already started typing in that chat. We'd love to hear where you're joining us from, maybe what agency you're with. If there's more than one of you joining us from your office, let us know. It just helps make this platform a little bit more personable, way for us to get to know our audience and where you're all joining us from. So it's great to see some folks from North Carolina. I see some Army combat veterans, mental health counselor as well. I know we have John from Armed Forces Recreation Network in the house, so welcome. But we are so excited today to have a colleague and a great friend of mine as well. Dr. Deborah Kelstead is an assistant professor and extension specialist at Texas A&M AgriLife Extension Service within the Family and Community Health Unit. She's also an adjunct assistant professor at the Texas A&M School of Public Health and a faculty fellow at the Texas A&M Center for Health and Nature. With her training and experience grounded in public health, Dr. Kelstead's research has really focused on evaluating multi-level community-based approaches aimed at improving health behaviors in a variety of settings and among different populations. Her current interests include exploring how community system social structure impacts population health specific to chronic disease and prevention outcomes. And a lot of her programming really focuses on environmental approaches to promote physical activity and initiatives to connect communities to nature. So without further ado, I welcome Dr. Kelstead. And Dr. Kelstead, you should have slide control at this time.
Thank you so much, Rachel. Can you hear me okay?
Yes, you sound great.
Great. And I have to say, I do not have slide control right now, so I probably need that. There we go. Okay. Again, thank you, Rachel, for that introduction, and good morning to you all. I'm so happy to be here joining you. I'm happy to be supporting you all in the work you do to provide care for military personnel and their families. And I'm seeing in the chat just the wealth of experience of people participating. So I hope this can be kind of interactive. I have stuff to share, but I'd also love to learn from you all and hear your ideas as well. As Rachel said, a lot of my research and programming has focused on improving populational health by promoting physical activity. That was where a lot of my early research started. But most recently, I've been starting to look at how being outside and being in nature can not only increase our physical activity and improve our physical health, but it can also improve our mental health as well. So we're going to touch on some of that today. Just as an overview, of what we're going to be covering in the next 45 minutes or so. I'm going to start by giving some background about some of the health problems that many of us are addressing in our communities as providers and caregivers. And then I'm going to discuss the benefits of getting outside and why being active in nature can fill a really important gap in helping our communities be healthy and happy. And then I'm going to finish up by giving some practical ideas for connecting individuals, connecting families, children, communities, and even ourselves to nature. So as Rachel said, my background is in public health. And in public health, we usually start by looking at the health problems we're trying to address. I go back to this slide a lot. We've known since the 1970s that obesity has been a problem in the United States. And one of the big reasons for that is it often leads to these chronic conditions later in life, like heart disease, stroke, diabetes, and even some forms of cancer. But the reason I show this slide is we see that despite all the physical activity and all the nutrition programming that we've been developing in the US, our obesity rates are continuing to increase. They're going up. It's been over 50 years since we started recognizing obesity as a problem, and we haven't really been able to stop that increase. And these numbers are especially concerning when we're seeing more prevalence among our children. Currently, almost 20% of children and adolescents in the United States struggle with obesity. And so I like to make the point that perhaps we need to start thinking about new approaches or try something different alongside of the programming we're currently doing. We also see these worrying obesity rates among our military populations, with 68% of our active duty service members struggling with overweight or obesity. And when we drill down and look just at obesity numbers, our military rates have more than doubled over the past 10 years, from just over 10% in 2012 to almost 22% in 2022. So we know, oh, excuse me, I jumped ahead. Let me go back a slide. There we go. We know that physical activity is one of the best ways to address this obesity problem. And like Rachel said, this has been my area of research for quite a while. Physical activity can help to prevent chronic diseases and to improve health. So I'm not saying we need to get rid of our physical activity interventions. The guidelines from the U.S. Centers for Disease Control and Prevention are that adults should get about 150 minutes of moderate to vigorous physical activity every week. And children and adolescents should get 60 minutes of physical activity every day. Now, many of you probably know that, but what's concerning is that 76% of US adults do not meet these physical activity guidelines for a number of reasons. And less than a quarter of children ages 6 to 17 are meeting the guidelines. So when you do the math, that's about the same for children and adults who are meeting and not meeting guidelines. Also, according to the CDC, only 2 in 5 young adults are weight eligible and physically prepared for basic training. So that's another statistic for us to be considering. So I think it's important for us to think about not just our physical health, but also our mental health. This is certainly a problem among Americans that's been increasing over the years. Almost 20% of adults experienced a mental illness in the year 2019. And between 2016 and 2020, we saw that children experienced a 29% increase in anxiety. And that was just one mental health issue. Military military service members and their families have unique stressors that can lead to mental health problems. In fact, according to the Journal of the American Medical Association, 1 in 4 active duty military service members struggled with a mental health condition in 2014. Now, I mention all these dates because those were data from before the COVID-19 pandemic. And we know that since the COVID-19 pandemic, we're seeing even more problems with mental health issues in the United States. So I think an important question for us to ask when we see these physical and mental health statistics is, where are we spending our time? Because maybe that can shed some light on some of the problems we're facing. Where are adults spending our time? Well, this table from eMarketer shows that US adults are spending more and more time with media. In 2022, adults spent an average of over 4.5 hours a day on their phones, almost 2 hours a day on computers, and over 3 hours a day watching television. Now, of course, this is a part of many people's jobs, including mine. I know that personally, I spend more than 2 hours a day on my computer, and so these numbers are probably slightly underreported. But this is what adults are doing with media with their time. What about children? They too are spending more and more time with media, between 7 and 11 hours per day. And the really difficult thing about spending so much time with our screens, adults and children alike, is that when we're doing that, we're often completely inactive, very much inside, and usually alone. Even if we're sitting next to somebody on the couch or have somebody at a desk next to us, we're really isolated when we're on our screens. Also of note, children are spending only minutes a day playing outside. And since the 1970s, children have lost about 12 hours a week of free time. And speaking of free time, we've also seen decreases in unstructured outdoor play when children do have free time. So when we look at how much adults are spending time outside, according to a study by the Nature of Americans, over half of adults reported spending 5 hours or fewer a week outside in nature. So that equals less than an hour a day. At first, when I heard that, I thought, that's not so bad, actually. If I could spend an hour a day outside, that'd be great. But when you do the math, an hour a day equals less than 7% of our waking hours in a given day. And that is certainly less than the amount of time humanity is used to being outside. Humans have spent 99.9% of our history living and working in nature, and now we spend less than 7% of our waking hours outside. So all these data show that adults and children have been spending more and more time indoors. We've really become an indoor society. Why is that? Well, some of this is due to our screen dependency, like I've talked about. Also, the nature of our jobs have changed. We've moved from agrarian work and being hunters and gatherers to working more with technology. We've moved from rural environments into urban and suburban environments, and that has moved us inside. Also, the nature of our parenting has really changed over time. We're very concerned with keeping our kids safe and in our eyesight, and we control a lot of the everyday activities of our children. And I'm going to talk more about childhood experiences in nature in a few minutes, because I think how we spend our time when we're young has a profound impact on how we spend our time as we're adults. A recent study by the Pew Research Center has found that family time is far more important than other aspects of life for most Americans. So this is a really important thing to think about. In fact, 73% of US adults rate that spending time with their family is one of the most important things to them personally, regardless of how much time they actually devote to it. So this is good because when we can see where people are prioritizing their time or where they want to spend time, perhaps this is a place that we can intervene. But in a study conducted in 2018, it was found that the average American family spends just 37 minutes of quality time together per day. So certainly this might be a place where we can think about helping families to increase the amount of time that they spend together. So those are a lot of problems to consider, and it can be a little bit overwhelming. What can we do as researchers, as practitioners, as providers, as caregivers? How can we help our communities improve their health? I think one way we can do that is by encouraging people to get outside. There's been a really promising area of research that's been expanding in the last 10 and 20 years, and that's health and nature research. And the pandemic actually accelerated some of the work that was being done in that area because people were being outside more than usual. And we're really hoping we can keep that momentum going. And this is really truly why I started getting interested in health and nature research. It was through the pandemic when we started to see an impact of being outside on physical and mental health. I'm going to talk for a few minutes about why nature is so beneficial and why I would argue why it really is so essential for our health. But before I do that, I would love to just pause and let you all have a chance to share in the chat what you like about being outside. Just share a few words or thoughts with the rest of us about your thoughts about being outside. Let's see what people have to say. Thanks for sharing right away. Jennifer, peaceful, calm, refreshing, yard work, fills your soul, sunshine. Someone says everything. That's great. Yes, sounds of nature. We're going to talk about that in a few minutes. The waves and the ocean. A lot about what we see, what we hear, what we feel. Yeah. Generally active when you're outside. Carrie talks about your senses. We're gonna touch on that. Spirituality. Yeah, these are great. I love to ask this question because I think if we're going to be helping people and provide care for people, we have to think about ways that we connect. So I often am reflecting on what nature means to me, how I like to be connected in nature. So thank you all for sharing. So there's a word for this connection, and I actually think I have lost control of the slides. Let me see. There we go. There's a word for this connection we have to the great outdoors. And an American biologist named Edward Wilson in 1984 coined this, the biophilia hypothesis. And basically, Dr. Wilson theorized that humans are wired to feel this connection to nature, just like many of you are saying. I saw the word connecting a lot in the chat, that instinctually, we're meant to be outside in nature. And when you contrast that with how much time we actually get outside in nature and how much time humans have spent in nature in the past, we see a real disconnect there. So I want to talk a little bit about how this connection to nature begins. This connection to nature begins even when we're children. I highly recommend this book by Richard Louv. I'm not sure if any of you have heard of this book before, but it's called Last Child in the Woods. And it talks about how current generations of children are missing out on their nature connection. Louv actually calls it a nature deficit disorder. And he uses a lot of research in his book that backs up the idea that many health problems that we talked about earlier, some of these chronic conditions, have been impacted by this deficit of nature in our lives. And he also talks about how it's really impacted negatively child development. when I think about my children's experiences in nature compared to my own when I was growing up, they're very different. I was what you would have called a free range kid who roamed the neighborhood from dawn until dusk with very little supervision. And I imagine there's some other free range children out there. But my own kids, who are now in their 20s, did not have that experience at all. Their experience was being driven to lessons and soccer practice and play dates. And when they were outside, they often had a lot of adult supervision. Even when they were playing soccer, it was with a coach who was telling them what they needed to do and when. And so these different experiences for children can have a long lasting impact on what they do into adulthood. And I'm not going to go into all the good and bad about how we're parenting differently than we were before. There are a lot of reasons for it, but we do have to recognize that it may be having an impact on children. So I want to just ask you again in the chat to talk about what your childhood experiences in nature were. Were you one of these free range kids like me, or what were some of the things you did when you were in nature? What did you like to do? What were you drawn to? I'll just let you take a few minutes to respond in the chat. We have a free ranger out there. Thanks, John. Okay, camping, climbing trees. Yeah, kicked out of the house, didn't come back until after dinner. Awesome. Someone who drinks from the hose. Yeah, I was one of those kids. Oh yeah, people involved in Girl Scouts, Boy Scouts. Water, woods, mountains, fishing, rode bikes for miles. These all very much ring true for me. I grew up in Michigan, not far from Lake Michigan. So I was definitely a water kid who would get in the water as much as possible. So I have a lot of childhood experiences in the water. I see some other people out there, horseback riding, building forts. Yeah. Well, I love to see these experiences in nature. Again, it's so good to know what we're connected to and how our experiences maybe have shaped what we do even as adults. So I've been doing some research in this area, and I've recently conducted a study with some colleagues of mine at the Center for Health and Nature. And it's actually just about to be published, but it looks at different childhood experiences in nature and how that predicts time in nature as adults. And what we found in this study was that there are different types of childhood experiences. So I'm seeing some of these in the chat. There's one type that we coined domestic experiences, and these would be these experiences that are close to home, on the streets, on the sidewalks, at the parks, the playground that are close by, riding bikes, playing with the neighbor kids. And those are certainly important childhood experiences. But another type of childhood experience emerged as well, and this is what we would call a more wild experience. And these are those camping trips over the weekend and hiking and fishing and hunting, all these things where we have much more immersive experiences for a longer period of time. And often those kind of experiences would take some adult organization to make them happen. But in this study, we looked at which ones were more likely to predict time in nature as adults. And we found, not surprisingly, that it was the wild experiences that were predictors of time in nature as adults. And I'm not saying we need to do away with the everyday experiences, but really think about how we might be able to combine some of both for the people that we're providing for, and especially for the children that are under our care. So I love this when we're thinking about really what counts as nature, how do we measure nature? This really gets at that idea of different types of experiences. This is a figure that's in a publication by Howard Frumkin, and he shows that there's different kind of doses of nature. We can go from having a micro scale or a small scale dose all the way to a large scale. So a potted plant in your office or in your house would be a small dose of nature compared to camping in the wilderness. But we can also look at how frequently we're exposed to nature, from occasionally to regularly. So a lot of times we can get these micro doses like grass and trees in our neighborhood, and we can do that on a regular basis. But you might do the bigger doses of nature only occasionally, maybe just once a month or once every few months. So the question that comes up when we look at something like this is, well, what's the optimum dose? What would be the best dose to prescribe to people? Well, the good news is that research is showing that even spending 2 hours a week in nature can have some health benefit. It can have some impact, but that goes up. So the higher your dose of nature, the more benefit you're going to get. And so I would argue when we can do, perhaps 2 hours a week of small doses of nature, but incorporate that with a large scale event like a hike or a weekend event in nature. And then that way we can really tap into some of those nature benefits. So how exactly does it work? How do you get from green space to health and well-being? This is a great model by Markovich and colleagues, and it shows that there are 3 different pathways that green space or blue space or brown space, I don't want to limit those since I'm a water person, this is how they can influence human health. Exposure to these spaces can help to reduce harm. So it can take away environmental stressors like pollution, noise, and heat, especially in urban environments. Green spaces and these kind of spaces can have restorative capacities. There's a lot of research that shows that nature can help restore attention, it can reduce stress. And then finally, these kind of spaces can also build our capacities. They can help us to be more physically active, and they can facilitate social cohesion. So there are so many benefits of nature on health and well-being. I'm not going to read every one of them out loud, but you can see that there are impacts of nature on social and emotional function, on physical and mental health. And in my area of research in physical activity, I know, and the literature confirms this, that adults and children are more likely to be physically active if they're outside. So if I'm creating a program or I'm trying to intervene and improve someone's physical health, I'm going to want them to do some of that outside, move activities outside, and you're going to see more physical activity from adults and from children. And here are some more benefits, and these are in the areas of cognitive function and in academic function. Again, there's a lot of research to back this up, but we see benefits on attention, problem solving, creativity, and with academic function, especially with children, we see improvement in behavior and in achievement, in engagement. And actually some of these belong over on the other slide under physical health. But we do see improvement in these things. I'll often tell my colleagues or graduate students that I'm supporting that if they're having a writer's block, if they're feeling overwhelmed, to take a break and go outside. And that's something I even do for myself when I'm having a trouble paying attention. I go outside, and that can help restore some of the attention. So thinking back on that slide from earlier when I was talking about the importance to many Americans of family time, there have been some studies that have done showing the impact of family time in nature. So I just wanted to highlight these. This first study was done in the US, and it showed that the frequency of family-based nature activities was really high during early childhood, but then it starts to drop off in other developmental periods. So during adolescence and high school. But what they found was that the frequency across all the periods of development for kids has the greatest impact on whether these kids will grow up to be adults who want to spend time in nature, especially when you can keep kids engaged during middle adolescence. The second study was from the UK, and it was showing how family outdoor adventures can really promote development and family well-being. So thinking about those more big scale type of activities. And then finally, in this last study, it was a study of US families that were receiving health-related services for low-income families. And they were talking about their visits to parks and what enabled and what prevented that. And participants reported that when they knew where to go, when they knew what was available, it would increase their park attendance. If they valued it with their family, if they perceived these places to be safe, and if they were able to afford it. So cost was definitely a barrier for families with engaging with nature. So in summary, I think it's important to think about how we can engage with families of children of all ages, not just dropping off in early childhood, and then helping families know about places they can go that are safe and affordable, and helping to overcome some of those barriers. There's also been very specific research on the benefits of nature to military communities, and maybe many of you are familiar with this. This first book, or excuse me, um, this first slide or highlight is from a book called Greening in the Red Zone. It's a chapter, and it makes the case for providing nature initiatives like gardening and hunting and fishing and outdoor adventures to military families before deployment. And it found that when you did that, it was building resiliency in these families that carried over into deployment and even after. The second two studies are with veterans, and it shows the long and short-term impact on veterans' psychological well-being, their social functioning, and the reduction in mental health symptoms when they are having immersive experiences in nature. And there's been quite a bit of work with veterans on the benefit of nature on some of these mental health issues. So given all this research on the health and wellness benefits of nature, how can we in our work help to restore that connection of our individuals, our families, our children, and our communities to nature? I want to just finish off today just by providing some resources, some practical ideas for you all. I wonder, I know Rachel has been monitoring the chat. Before I go into this, Rachel, do you have any comments or any questions you wanted to highlight for me, because you're better at monitoring the chat while I'm talking here?
Yeah, well, and Kitty asked a question. It was kind of at the very beginning of today's session when you talked about obesity. And her question or statement is really a significant limitation of the obesity criteria is that it relies primarily on BMI as opposed to metabolic health versus fat mass. And so many military members have a higher muscle fat ratio than the general population. So she was curious about the statistics on obesity presented in military members, and might this be an overestimation? I don't know if you can answer that or not.
I think that is actually such a great point, and this is definitely one of the limitations to the research that's been done in the area of obesity. We go as physical activity researchers, we talk about this a lot at conferences, and one thing we go back to is right now BMI is our best measure, especially when we're looking at populational health. It's right now the measure that we can show change over time, but it's not always the best measure. Like we're talking about with the muscle to fat ratio, it's not really getting at in people's health in the way that we want to. So there's definitely room for improvement. And I go back to the obesity statistics because for me, it helps us understand what we're doing over time. I don't want to discount, though, the idea that we need better and improved measures at finding out about people's health. So I'm really glad you raised that point, and do know that this is something that we are talking about a lot in our academic communities. How can we get better measures so that we can more accurately describe the health of our communities? Thank you for asking that question. Anything else, Rachel, or we'll move
Well,
on?
and Kitty also just made a comment about some of her research interests. So in her area or region, she works with youth substance and the juvenile justice system. And so she's really interested in the data about the impact of nature time on addressing these as well.
Oh, I think that's great. That would certainly be another area for exploring. I'm pretty sure I've seen studies out there. It's just not something that is in my specific area of expertise, and so I think that's a really good point as well. So thank you, Kitty, for sharing these comments and questions.
And just one final question that came through from John is, where is the medical and clinical community related to the power of nature when it comes to mental health? It seems like advocacy doesn't see that strong in those communities, is what he mentioned, coming from someone in recreation.
I think that's a great point, John. I think what I'm seeing is this recognition of the impact of nature is actually growing. And even though we've been studying nature and its impact, often we're looking at, oh, how does nature impact, or time in nature impact our environmental attitudes, and less about how it actually impacts our health. And this, like I said, has been an area that's growing in the last 10 to 20 years. Really, the studies have just been exploding. And so my hope is we're going to see more and more down the pipeline because of the research that's been expanding, and even the research that's been done since the pandemic. So it takes time to get research into practice. This translation of, just because I did a study on childhood experiences in nature doesn't mean we're going to have practical implications and programs disseminating because of that. It does take time. So thanks for pointing that out. And I certainly hope this is something we see more and more of in the future. And we're going to talk about, I see John made a comment about prescriptions. So we're going to talk about that in just a few minutes. So in the interest of time, I'm going to move forward, and then we'll have some more time near the end of the presentation to talk some more. So I would like to share some practical ideas, but first I think it's important to discuss some of the barriers that people report to getting out in nature. There's been some research in this. I've conducted some focus groups with families in Texas, and a lot of these things come up in the discussions. So common barriers include accessibility, affordability, proximity and location, issues of safety, transportation, equity and access, time, not feeling welcome in nature spaces. Some spaces don't feel like they're inviting to everyone. Lack of exposure to nature in childhood, we talked about that. Health problems and crowded facilities. So when we're creating programs and implementing different initiatives, we really want to address these barriers and make it really a part of our programming. We can't just wag our fingers and tell people to get outside. We have to make it easier for them to get outside and help them to feel comfortable. And not just some people. Again, I study public health. I'm about looking at populations. I want to make sure that everyone can access nature and they feel comfortable and welcome in these spaces. And one last thing I think it's important to think about is, if we're trying to make lasting behavior change, we need to consider evidence-based strategies for how we do that. So these are some evidence-based strategies for how we can connect our communities to nature. Again, these would be important to be part of any programming, any ideas we want to implement. We want to help people engage all of their senses. That came up so much in the chat. People talking about what they could hear, what they could smell, what they could see. If you're going to get all those great benefits, you have to be able to engage your senses. And to do that, we might need to get off the beaten path a bit, get off the sidewalks, get away from the cars so that we really can engage all the senses. We want to help people increase their knowledge, build their skills. It's really helpful to know what plants that you need to avoid, or what snakes are poisonous, or how to pitch a tent. These are important things to do if we want to help people be outside. We want to help expose them to new experiences, things they've never tried before. We want to shape attitudes, so help overcome fears. We want to consider everyone's needs, everyone's abilities, and we want to be able to provide equitable access. So these are strategies we can use in the programs that we are implementing. So I'm going to share just a few of our tried and true AgriLife extension programs. These have had great success with getting Texans, adults and children, both eating better and engaging in physical activity. And notice I didn't say getting them in nature. These are our physical activity and nutrition programs. Walk Across Texas is a team-based walking challenge program. Better Living for Texans is our nutrition education program for SNAP participants and SNAP eligible adults and children. And then Learn, Grow, Eat, and Go is a school-based gardening initiative. The great thing about all of these programs, very much so with Learn, Grow, Eat, and Go, is that they are programs that can be done outside. So you don't have to necessarily create all new nature-based programs. You can take your current programming and figure out ways to help people do some of the elements of these programs outside. And we're doing that in some of our programs here in Texas. I do want to highlight a new program, though, that I've worked to develop, and Rachel has been a wonderful partner in this, and Andy Crocker as well. This program is called Get Outside, and this is a nature-based program. This is a program that aims to help families boost their health and their happiness and their time together by being more active in nature every single day. And I'm so excited because we just launched this program. We're piloting it in partnership with Joint Base San Antonio Lackland, with military families and in their after-school program. So here are some pictures from a couple weeks ago. It was so wonderful, and I'm just so excited to be able to partner with OneOp and with our military community to implement this program. So just a couple more details about the program. It is again aiming to work with families, and it's offering different activities close to home, helping to overcome some of these barriers. It engages all 5 senses, encourages families to do everything from make mud pies to go for a walk in the forest. And we're hoping we're going to increase time outside in nature, increase physical activity, increase time as a family, and improve physical and mental health. So I'll keep you posted. We're evaluating the program, and we're hoping to disseminate it statewide and work in partnership with even more installations in Texas. So I'm going to finish up just by highlighting some websites that I'm familiar with in my work. I'm sure you all have some that you've worked with, some places you go for resources. But I'll start by talking about nature walks and hikes. We Are Outgrown organization has a great website, talks about how you can do some nature walks and hikes with our littlest ones, how to take toddlers out on walks and hikes, and they've got some great ideas. Like getting the toddlers out of their strollers, letting them go slow, letting them stop and look at things, and just let them be the leaders. There's also ideas I've seen about going on hikes and walks with older children, letting them be the ones in charge, be the hike leaders. I love the phrase, be the guide on the side. Sometimes adults, we love to take over. Ways you can let our children be more independent, especially the older ones when they're on a walk or a hike, is to provide them with walkie-talkies or whistles. I love to give out whistles to kids when they're hiking, because you can have a system where if they're in trouble and out of your eyesight, they could blow the whistle 3 times and we can run and catch up. Another walking program is called Walk with a Doc. Some of you might be familiar with that. That was started in 2005 with Dr. David Sabkier, and he started by inviting some of his patients to go for a walk outside with him where they could talk about health issues. This program, 19 years later, it's grown into 500 chapters around the world. So you can check out that program at the website. By the way, all of these resources are listed on that resource sheet that's supplied at the webinar website. And then I want to talk about Project Learning Tree. They have ideas for 12 nature walks you can do for Earth Day or really any day. So they've got some great ideas. Project Learning Tree is an organization that advances environmental education using trees and forests. It's a great resource. So I encourage you to take a look at that. And speaking of Earth Day, it's coming up April 22nd, right around the corner. We can use events like Earth Day and other national events to get our communities connected to nature. Often on the websites at some of these places, you can see local events happening, or you can create your own Earth Day event. AmericanHiking.org provides great information about hiking, especially for families that have never hiked before. They have what's called First Day Hike. It's the first day of January every year, and it's for families with children 8 years and older, and they can learn all about how to hike and how to be safe on the trails. American Hiking also has a National Trails Day on June 1st of this year. April is Month of the Military Child. This is a great time to deliver outdoor programming to military families, and we very much intentionally launched our program during Month of the Military Child. Also, April 3rd just passed. The American Heart Association has National Walking Day, a great day to organize a nature walk. And then Rails to Trails Conservancy has what's called Celebrate Trails Day on the fourth Saturday of every April. This is just a handful of things happening here around April and in the spring, but there's a lot you can look at around the calendar to get our communities connected to nature. Also, there are a lot of programs that help to remove some of the barrier of cost. I love the Every Kid Outdoors program. This is provided by our National Park Service. This is for every fourth grader in the United States. They're all eligible to receive an annual pass to the national parks, and that includes their families. It's just such a great program. The National Park Service also offers free military passes for current U.S. military and dependents, and free lifetime passes for Gold Star family members and their veterans. So if you don't know about that program, go to that website and check it out and connect your communities to those programs, because these are just wonderful resources and wonderful ways to get over that barrier of cost. The National Park Service also offers free access for U.S. citizens and permanent residents with permanent disabilities. And this is a really important program to help overcome some of those barriers of access as well. An organization that helps to make the outdoors accessible to everyone is called Disabled Hikers. I think this is such a great organization. They provide information, resources, events. They really want to make it so that everyone has access to nature, and I think this is so important for us. There's also the Sierra Club's military outdoors program, and that helps to remove the barriers to the outdoors, like transportation and cost for our military members, our veterans, and their families. We talked briefly about gardening. I think gardening is one of the best nature interventions. Well, it ticks a lot of boxes. It can be a great physical activity intervention. It can be a great nutrition intervention, and it gets us really connected to nature. And so don't discount the idea of connecting to our naturalists, our gardeners, our farmers. The AARP Livable Communities has an excellent resource you can download. It's called Creating Community Gardens for People of All Ages. And this is a toolkit that providers like y'all could use. Neighbors, local leaders can use it to create gardens for people of all ages and abilities. And I do want to say, I think sometimes creating a community garden might seem overwhelming, but there's a lot of ways we can get kids and families gardening. You can do small container gardens. You can help children plant a single plant in a little container and watch their awe with watching a plant plant grow. We can plant trees. I love tree planting initiatives. We can also observe trees and plants. There are programs where people can adopt a tree in a nearby park or a green space and watch and observe it change and then report back data about how it's changing. There's an organization called Project Budburst and Nature's Notebook. And these are places you can set up an account and report on changes to plants or trees. It's just a great way to help people collect data on changes in our environment, and kids really become great scientists using programs like this. Sometimes it's easier to get families out in nature when they can be with their friends. So I love these nature activities for families. The Children in Nature Network provides a great toolkit for families who want to start a family nature club. Right now, there are over 200 family nature clubs in North America through this initiative. I want to highlight the Blue Star family. Some of you probably know about this, but they have an outdoor explorers program where they're providing scavenger hunts, trail maps, all kinds of neat ideas at their website. And then the National Park Trust has military family programs that provide really memorable experiences like fishing and hiking trips. So that's also a really great resource for our families and our communities. For more ideas for families, I recommend these books. The Nature Connection has great ideas. I have this on my bookshelf. I love to give this book to people. It's just got seasonal ideas. I highly recommend it. Also, Vitamin N by Richard Louv. Very different from his other book. This has got hundreds of practical ideas for connecting children to nature. And then there's a lot of books and games for families. We all might be familiar with The Very Hungry Caterpillar, but there's all kinds of books out there about nature for children. There's also young adult books like Island of the Blue Dolphins, Julie of the Wolves. Talk to librarians. They're going to be able to connect you and your families and the people you care for to all kinds of neat books. And then I wanted to talk about this game. I just bought this game for my nieces. It's their birthdays this week, and a match a leaf memory game. What a great way to play with your family and learn about nature. All right, just a couple more things. Nature events are great ways to connect our communities to nature. In Extension, we have an Extension agent who just hosted in 2022 a really neat nature event where she partnered with her healthcare providers in her area with the Texas A&M Forest Service. I want to highlight here just how important partnerships are. I've hosted some events in our state parks here in Texas by partnering with Texas Parks and Wildlife. They are one of our great partners, and they're often willing to donate passes, space, interpreters, educators. So really look at partners too when we're thinking about some of these nature initiatives. And then one of the last ideas I want to highlight was nature prescriptions. I think that came up in the chat. I'm thinking that many of you are familiar with this. We have a lot of prescription programs all across the US. They kind of vary by community. Some are very small, some are bigger. The biggest thing that I know of, the most national program, is called Park RX America. And they have a lot of resources at their website. They give all the ins and outs as to how you could get started as providers in prescribing nature to your patients. So I encourage you to learn more at their website. And they've got some really the good resources for caregivers and for providers. Before I wrap up, though, I want to say that we do need to take care of ourselves too. All of these benefits of nature apply to providers and caregivers like yourselves. And sometimes we're so busy that we aren't doing the healthiest things for ourselves, and we're not really modeling these healthy behaviors to the people we're providing for. So ParkRx actually had some great ideas. They shared some things we can do as providers. So I'll just walk through these very quickly. Of course, walk is the first thing. It's one of the simplest things we can do, but really take a walk outside as often as you can. The way you can do this is by moving a meeting outside. You could do a walking meeting. I've done this with people. If I write something on my calendar, I'm more likely to do it. So perhaps write a walk in on your calendar to help you prioritize walking. You can also bring nature inside. If my camera were on, you would see the number of plants I have in my office. So you can bring nature in, you can show, hang artwork and photos of nature to bring some nature inside. And even that has benefits. Take a real lunch break. This one really I struggle with, but get away from the screen for about 20 minutes. If you can, maybe take a lunch break outside. Do a sit spot. This is new to me, but this is the idea of going and sitting outside, hopefully somewhere in nature, and just sitting for 5 to 15 minutes and stop and listen and breathe. It's a real mindfulness activity just to slow down and engage all of your senses. And then if you want something more immersive, there's a nature therapy walk. We have trainings for nature therapists. We have at Texas A&M Forest Service some nature therapists who have been taking us on walks in our university community. So that's a very much more immersive experience. It kind of comes from something started in Japan called forest bathing, but that's also a way that we can really care for ourselves in nature. So nature really is the best playground, not just for children, I think for adults as well. And I hope you've learned some how important it is to connect our communities to nature, to connect ourselves to nature. And I hope that you're able to get outside sometime today. Here are a few additional resources that I didn't have time to highlight, but they're on that list of resources that are provided. And I will stop here and just let you ask some more questions, or we can have a little bit more discussion. And I know Rachel had some closing items to discuss as well. So thank you all so much for allowing me to present today with you all.
Thanks, Dr. Kelstead. Well, while we're on still and we still got your full attention, Dr. Kelstead, I'm going to open it up for questions or comments, but I'm also in the meantime, while folks are typing any last minute questions or comments, I'm going to briefly go over our CE credits that we have for today's offering or for today's webinar. And then I'm going to briefly go over next month's webinar because it's really going to touch on the benefits of what you discussed today and how we can help individuals with disabilities. So briefly, if you are interested in CE credit or just a certificate of attendance, we are offering several professional continuing education credits for providers. And so you can see that list here. We got social work, LPC, LMFT, case manager, patient advocates, for certified family and consumer sciences, certified family life educators, dietitians as well, nutritionists. And then again, as I mentioned, those certificates of attendance for just needing a clock hour to provide to your supervisor. We also offer those. What you're going to do is I posted a link, and I know we've posted quite a few links in the chat, so hopefully you're not too overwhelmed. But in the chat, I posted a link again to our webinar event page. This event page, and you'll see the link as well on your PowerPoint slides right now. That link is to our webinar event page where you can find a list of Dr. Kelstead's resources that she's provided today, a copy of today's PowerPoint slides that also includes a lot of these links as well. And then just some additional connections that may be of interest to you on that webinar event page. And then you're also going to find, most importantly, I know for a lot of you providers on, is the continuing education section. There's going to be a nice purple button that will appear once you go and click on that continuing education button. You're going to be taken to a survey. You're going to need to complete that survey in order to receive your CE credits or certificates of attendance. So you're going to carefully go through the prompt on the survey and answer any questions and get your automatically generated email certificate. And Coral has also so kindly posted a direct link to those CE opportunities as well in the chat box. I am going to briefly review next month's webinar, especially since Dr. Kelstead was really talking about health and wellness today and getting outside in nature. We're going to continue this conversation. So join us on May 8th. So next month, May 8th from 11 a.m. to 12 p.m. Eastern Time for our session on Rooted in Resilience, Cultivating Well-Being in Individuals with Disabilities. So we're going to explore the transformative power of gardens and gardening in enhancing the lives of individuals facing diverse disabilities. So we're going to go over physical, emotional, cognitive, and social benefits of gardening for individuals with disabilities. We're going to explore some strategies for selecting sensory elements, plants, and design features to cater to specific disabilities. We're going to identify some key principles and design elements that make gardens accessible and welcoming for individuals with varying abilities. And then we're going to really just talk about and recognize the significance of creating garden spaces for those individuals with disabilities. And so what can your installations do? What can your communities do? How you can support those communities in creating accessible gardens for those families that you're working with. So please get connected to next month's webinar, again, May 8th, Rooted in Resilience, Cultivating Wellbeing in Individuals with Disabilities. We have about 2 minutes left. So we're going to stay on if you have any last minute questions, for you to gather any last minute resources and links in that chat. But I also just really want to give a shout out to Dr. Kelstead. Thank you for the wealth of information today. A great presentation, lots of resources. We really appreciate your time today. And thank you for all of you that are joined or that have joined us today. We really appreciate your time, your comments, your feedback, and sharing of resources. So thank you. Hope you have a great rest of the afternoon or day. And we'll see you on another OneOp programming. So thank you.
Yeah, thank you, Rachel, and thank you, everyone. I'm getting a chance to catch up with the chat, and I do appreciate everyone sharing. There's a lot there. I'm hoping I can get some of these links as well. So thanks for all the interaction. I appreciate it.
All right, so we are at the top of the hour. Thanks, everyone. We're going to begin closing out.